Hello, I'm Richard Westerby from Ivy Fertility Services, and today we have the amazing Dr. Nurit Winkler from Los Angeles Reproductive Center.
Very excited to be here and be part of this podcast, which I think brings a lot of knowledge and help. So thank you for having me.
You're welcome. So today we're going to talk a little bit about navigating your fertility treatment options. When you see a patient, how do you figure out exactly what it is they need to do?
Now, that's a very good question because, of course, there is the medical part, and we go through all the testing and try to understand what the underlying cause of the infertility. But once we have that, I think it's very important that whatever treatment options we're giving to patients will match their own desire and belief. For example, I can think that in vitro fertilization will be the best option, but the couple wants to try and conceive naturally or conceive in a more natural way. And I am a true believer that you need to feel right with the treatment that is given to you. It's not about numbers, and not even necessarily about success rate, So I see my role as finding out the cause for infertility and give them the different treatment options and be very respectful of those treatment options. I'll give you an example. I had an international couple recently that were using donor egg, and it was a single parent, and she used donor sperm and would not do ICSI. ICSI is when you take the sperm and inject inside the egg. Now, in those cycles, because those cycles are so complicated between countries with egg donors, we always recommend ICSI. But in her mind, there was this story of a friend of her that did ICSI and there was problem with the baby. The amount of stress of her doing ICSI was way above getting less embryos. And we made the decision. We said, why don't we find an egg donor with a lot of eggs, divide them half-half, and that way you can have both. So that's an example of there's no point to me trying to explain why ICSI will be better. I need to be very respectful of her wishes, understand her fears, and know what will work best for her. So I think the right fertility treatment to some degree is what works best for you.
That's really interesting. So just to recap, ICSI is when you inject the sperm into the egg.
Correct.
And what is the other option?
The other option, that's a good question. I'm talking like everybody should know that. So the other option is to let the sperm go inside the egg naturally, which is a great option. Actually, there's many advantages of what we call the insemination, but we very rarely do it with donor egg because it's such a complex cycle. The donor egg will only donate once sometimes. There is a lot of financial things that go into that. And when you do this natural fertilization, sometimes the egg will not fertilize and the cycle is pretty much destroyed at that point. So if it's a couple, the wife can decide, you know what, I'm going to do it again. But when it comes to an egg donor, that patient lost the whole egg donation. So to play it safe, we usually recommend to do this ICSI when we inject the sperm inside the egg.
So ICSI almost increases the probability of fertilization.
Correct. With ICSI, you're almost certain to get embryos. If you have enough eggs with natural fertilization, once in a blue moon, it can happen that it will not fertilize, not to mention with frozen sperm, sometimes we kind of recommend that. So that was a case in which we had donor egg, we had frozen sperm. So we have all the reason to recommend ICSI, more from an efficiency, but the intended parent didn't want to. And the amount of fear that would cause her just did not justify that.
So do you find that, for example, when I go to the doctor and I have XYZ and the doctor says, do this, I would typically do it because I'm like, you're the expert, you know best. Do you find that you end up having a dialogue with your patients around what their hopes, dreams, and desires are versus this is what I think?
I think it's a balance. I think that, the idea of telling someone this is what you should do, I think it's very paternalistic, because ultimately, I think my role and the physician role is to present you with all the options, present you with a success rate, and let you choose based on your belief and desire, what you want to do. I mean, I've had patients came to me, for example, and then, the physician told them, well, you're 45, you can't get pregnant. First of all, it's an awful thing to say. It's not correct. Until you're in menopause, you can get pregnant, even in the perimenopausal transition. So I think it's black and white that you hear sometimes physicians saying. It's very paternalistic. It's very aggressive. and not justified. I can tell my patient, listen, your chances are very low. Risk of miscarriage is high, but I will never tell a patient you cannot get pregnant with your own eggs. And I think that within the physician community, I want us to be better at that, not to be so like black and white.
And understanding the motivations behind the patient, and if that's what they want to try and do, that's what they can do, will support them in that decision making.
Exactly.
I think that's what really does set Ivy aside. I think it's very much a joint team effort. What are some of the things that people can do in order to, you've provided some options. I'm thinking holistic medicine or Reiki or acupuncture or things like that. How can we integrate that? Do you integrate that? Do you believe in that? How does that all work?
It's a balance. I would say the first thing, and we see it on males and females, but somehow a bit more females do not feel guilty. Meaning you have so many women that feel like, maybe it's my stress. And it's like a catch-22. Like, oh, I can't get pregnant. Everybody tells me I'm stressed. Now I'm stressed and I'm even more stressed because I can't get pregnant. It's not true. I think that the guilt sometimes is counterproductive, knowing that fertility it's something that happened. Like we all face challenges in life and comes from different directions throughout our lifetime. And some couples or some single will have to face it. So not feel guilty about that and knowing that there's nothing, you've done in the past or in the present to cause that, whether it's a previous termination of pregnancy or so on. The upside of it, I think that a lot of women and men too want to feel empowered, saying, hey, I can't leave it to the luck or your fertility guidance. I want to be able to do something. And I think the best thing to do is really find ways to help yourself. And everybody can be helped in different ways. For example, acupuncture for certain patients, it's a great option because it allows them to be more relaxed, to go to a place where, they're more relaxed. They can tolerate, their stress better. And not that the stress will cause you infertility, but will make this whole treatment more painful, emotionally. For some, it's the diet, saying, hey, I want to be more healthy for the pregnancy. Again, it's every patient different. On the second, we have somebody who has a very tough schedule and don't like needles, and to tell them, listen, go to do acupuncture, sit like 3 hours a week in a place and get needles. I'm probably doing the opposite. I think that there is place for all of those things to help tolerate fertility treatment better. And besides, we're looking at fertility as one of the most stressful things in people's life. You put like cancer and then you put death in the family, and somewhere around that you have dealing with fertility. And it causes so much of marital issues. So anything that can be done to help you not necessarily be more successful, but navigate it with less stress is a great, great option.
So that's interesting. So you're saying that it doesn't necessarily help the quality of the egg or the sperm, but it helps you can manage this process better, which in effect then helps the whole process.
Absolutely. And, it goes back to sometimes we see a couple and, she drinks some on the weekend, a glass of wine and not while you're pregnant or so on. And then everything changed and he cannot drink, she cannot drink. They cannot do that. They cannot exercise. And before you know it, this all of not you should be doing creates so much stress that is counterproductive. So I'm like, go enjoy your wine on the weekend. It's not going to affect your eggs. That overly restrict yourself is counterproductive. Live a normal life, work out, exercise, find everything that can help you. Don't over restrict yourself, whether it's diet or,
That's really good. I mean, obviously you're LA Reproductive Center, so it's very LA to do lots of holistic and oxygen breathing and all those different things. But I think the point I take away is it's not harmful. It won't necessarily increase your chances of success, but it's going to help you to tolerate the process better.
Correct. If that's something you believe in and it feels right.
And what other things can help somebody who's looking at this before they start thinking through steps they can do to navigate better?
The number one, go to a fertility center as soon as you are concerned. Some people kind of try to wait. It's the sense of control. Well, I don't think I have a problem. Let me wait. Sometimes it's come from the partner, let's wait. And maybe the conception that you come to an IVF center, they put you through IVF. And it's not true. I think that the earlier we learn about the problem, the more time we have to try and even treat it in a more natural way. So if there is sperm issue, and if we discover that the wife is 44, we don't have that time. If we discover it when she's 37, we have more time to try and work with that. So not to be afraid to seek some initial testing as soon as possible.
That's really interesting. So doing your diagnostics, it's almost like when you look at your computers, like run the diagnostic checks just to see if there is a problem, because if there is, then we can try to figure it out early and deal with it early versus waiting and then seeing.
Exactly. We have sometimes couples that, they come to me at age 41 and they have well, you can't talk about unexplained because their age factor, but the same couple would have come to me 4 years before. I could have offered them so many other treatment, and now we're more to like, okay, we may have to go to IVFs. Yeah.
So what are some of the other treatments that can be offered?
Well, it really depends on the underlying diagnosis, on the underlying cause of infertility. There is a lot of misconception. For example, you hear a lot of couples or single coming in and saying, hey, can we do an IUI? Like taking the sperm and inject it as a treatment. IUI will be useless if the sperm is good, unless people cannot have intercourse or have other issues. So I think that the different treatment really depends on the diagnosis, but also being honest, meaning sometimes we all have the feeling of like, let's just do something, but you have to do something if it makes sense. I'm not going to just say, hey, let's try an IUI or let's try a medication called Clomid just to feel we're doing something if I feel like, listen, that's going to help you. I'll be very honest about that.
And what does Clomid do?
So Clomid is one of those medications that trick the body to believe there's not enough hormones. So the body then increase the natural hormones and help ovulating more regularly. So Clomid is a pill that, you take for 5 days, and it's mainly done for women that don't ovulate, right? But you hear a lot, out there like, oh, can I try Clomid? Like if you're 42, Clomid won't help you. If you're ovulating regularly, Clomid won't help you. So I think each treatment is really right for the right diagnosis. The flip side is the same IVF. I had a patient yesterday that I had a consult with, and she's young, she's not ovulating, and she wanted to do IVF. I'm like, I respect your wishes, at the end, we'll do what you want, but there's so many other things we can do before IVF. So, make sure you kind of discuss that.
And this is that navigation aspect where you're sitting with a patient and understanding them, offering them the landscape of what they could potentially do. And that's really important as a person who isn't involved in this industry, to be able to have a professional to say, here are your options and what works best for you, and we can figure that out. And the sooner you do that, the better, because as you just rightly pointed out, the older you get, the narrower the options you have are.
Exactly.
That's really powerful. Thank you very much.
Thank you. Thank you for having me.